Hey, this is Dr. Rob Cananello from Orangetown Podiatry, and I wanted to talk to you about a topic that I talk about daily with patients, and that's plantar fasciitis. What is it? It's heel and arch pain, right? And it seems like it's an epidemic now. Not COVID, but it's an epidemic. People are constantly having to come in with pain that they say they have been having when it hurts them, when they get up in the morning, first step out of bed is killing them, or if they've been driving for a while or just sitting for a while, they get up and they get this pain. So what exactly is it? Well, the first thing everyone wants to say to me, is it a heel spur? Well, I'm going to tell you right now that lose that word. Heel spur has nothing to do with pain in the bottom of the foot. The heel spur sometimes is noticed on x-rays, but it's just a secondary event. It's something that we actually see or don't see if the patient has heel pain. What exactly is it? So the fascia, if you look at the foot, on the bottom of the foot, there's a band of tissue that runs from the inside or medial part of the heel to the base of the toes, okay? And that band of tissue is kind of like my glove here. It's kind of like this elastic band that goes from the bottom of the foot all the way to the base of the toes. And what it acts as is basically a support or a strut that kind of allows the foot to move in a better plane. What happens though is over time is that the foot might have a movement that is too aggressive in one way or the other, or you might be asking for too much of a load to that tissue, or the muscles underneath that band of tissue are not working as well as they can, and over time that band starts to pull and pull and pull too much to almost to the point where it can rip and tear, and that becomes an issue. Once it starts to tear along its line, you start to get these areas of scar, and that scar, now we call this plantar fasciosis, which is actually a scarring of that tissue, as opposed to plantar fasciitis, which is an inflammation of that tissue. That scarring becomes really painful, and we lose vascularity to that area. So there's a lot of different things we can do, such as support, stretching, flexibility, using heat. What I use in my practice a lot is a regenerative medicine, such as shockwave and magnetic therapy. Those things all seem to help restore and regenerate the tissue back to where it should be. I'm going to go into some more detail in the weeks to come about how we can really help this a little bit more. But I just wanted to give you an idea of what's the difference between heel spur, which we said has nothing to do with the pain, and plantar fasciitis or plantar fasciosis. So stay tuned, there'll be some more to come. Thanks. This is Dr. Rob from Orangetown Podiatry.